kia ora iho. E tautoko ana I ngā mihi kua mihi a ki te mana whenua. Me huri te kei o tōku waka ki te whare o Pōtatau, te kingi Maori, me te kahui ariki nui tonu. Pai marere ki a rātou. Hoki anō mai ki a tātou e noho nei I raro I te tuanui o tēnei whare, tēnā koutou. So the significance of the whariki design on this slide is one of our colleagues, Tawhanga, who will be presenting later on in the conference, has often talked to us about the work as a weaver, as a kairaranga, is to be reflective and responsive to your material. And I thought it was a really good analogy for the presentation today. He talks about the need to pause and evaluate the work and to respond to the mauri of the fibre, what you're working with. So just keep that in mind as we proceed with this presentation about building relationships with Māori communities for effective sexual and reproductive health promotion. I'm pushing along, all right? There you go. Okay. Health organisations that are government funded are required to plan and deliver services that meet the needs of their communities, and this includes Māori communities. However, Māori community health needs are not always accurately identified. Some health planners assess the needs of the population as a whole. Some fail to account for the health disparities that exist between Māori and non-Māori, despite the fact that addressing disparities is also a requirement of government funding. Te Whariki Takapau often receives requests from sexual and reproductive health organisations, both mainstream and Māori, for information to help them engage more effectively with Māori. Many of these organisations have a sense that they could be doing a better job of working with Māori. They're committed to eliminating inequities. They want to be able to plan and deliver services that match the priorities of Māori communities. However, they're unsure of how to achieve these outcomes. That's one of my communities in the far north, in Oturu, near Kaitaia, west of Kaitaia. Aue, ko he tō hangarau e ho. Ana, kia ora. Yeah, something up with your... By way of response to these requests, in 2016, Te Whariki Takapau published Manata Tangata Whenua National Guidelines for Sexual and Reproductive Health Promotion with Māori Communities, otherwise known as the Guidelines. It's a bit of a mouthful, otherwise. This booklet is approved by the Ministry of Health as meeting the criteria of Rauemi Atawhai, a guide to developing health education resources, and it is designed to assist sexual and reproductive health promoters to undertake effective Māori community responsive health promotion. In seeking to create best practice guidelines for working effectively with Māori communities, and in the absence of any existing sexual and reproductive health promotion guidelines, we looked at adapting one of the more well-established Māori health promotion models. Those were, you know them, te whare tapawhā, te pai mahutonga, te wheke kia uru mai a hauora. In the end, however, we settled on adapting a model that is less well known, but that would be relatively easy for our target audience to understand, and most importantly, would facilitate our objective of bringing sexual and reproductive health promoters and Māori communities together. Ko he anō. Jeepers. So, please give me the secret. I'm pushing this right-hand button. Aha. Ko he te kai kōrero. Okay. Nōku te he. The pōhiri model of respectful engagement, first developed by Kahu McClintock and her colleagues in the field of mental health, is based on the pōhiri ritual of encounter. We adapted Kahu's pōhiri model to guide the process of relationship building between tangata whenua, who are the hosts, and in this context is Maori communities, and manuhiri or visitors, which are sexual and reproductive health promoters. Miharo. 4 elements make up the pōhiri model, and these align to the key stages of sexual and reproductive health promotion activities. So we start with the pōhiri element, which is planning and relationship building, followed by the hariru element, which is partnership building, the hākiri element, implementation, and the poroporo aki element, evaluation and ongoing relationship. Without a doubt, the most critical stage in the process of engagement is the beginning. The pōhiri element highlights the fundamental importance of planning and relationship building to establish a solid foundation for effective sexual and reproductive health promotion with Māori communities. So back in, talking about the development of these training videos that we're launching today, back in 2016, we piloted a guidelines training workshop focused on the pōhiri element with a national sexual and reproductive health organisation, can I name it? Which was Family Planning. And upon review and evaluation of that workshop, it was pretty clear that promoters required more actually in the way of support to be able to integrate and understand these new concepts and approaches that were outlined in the guidelines into their practice. Te Whareki Takapo had always envisaged delivering the important first stage of the pōhiri model, the pōhiri element, in a face-to-face format, and then making the other 3 elements available via some form of webinar or video. Realistically, however, we had neither the budget nor the resources to facilitate face-to-face delivery nationally. And from there, the idea for a series of training videos to assist promoters to use the guidelines was born. So who are these videos for? While they were made explicitly with sexual health promoters in mind, the principles of effective engagement encapsulated in the videos are equally appropriate for clinicians. For example, clinic strategic plans should ideally be developed in partnership with tangata whenua, with Māori communities. And in order to do that, that necessitates relationship building as the first step in that process. So they are relevant for clinicians, and they're also relevant for researchers, project leaders, and policymakers. Oh, did I move on? Sorry. After evaluating the pros and cons of webinar and online video formats, we decided that videos were the least complicated and most accessible means of providing training to sexual and reproductive health promoters in diverse work environments and locations. As we've found with other sexual and reproductive health projects that we've undertaken in response to particular needs of our communities, we often find ourselves, in a sense, sort of breaking new ground, if you like. And experience has taught us that working in stages, or what my colleague Vernon likes to call sprints, piloting and evaluating the project stage by stage, and incorporating changes and learnings along the way is the most effective way of working. For that reason, the training video development has been undertaken in 2 stages, and what we are launching today is just stage 1 of the process, which involves videos 1 to 4. So out of a series of 7 videos, what we're launching today is the first 4 of those. Before I give an outline of what's in the videos, I just need to mention our guest presenter, Hoturua Kerr. Matua Hotu is well-respected in waka circles, both nationally and internationally. He has been instrumental in the revitalisation of waka ama, or outrigger canoe racing as a national sport. He's involved in the revitalisation of waka haurua voyaging, that is double-hulled ocean-going voyaging waka, and also the revitalisation of traditional Polynesian navigation methods of navigation. Great honour to have him in our videos as a presenter. A few years back, Matua Hotu presented at a sexual health symposium in Hamilton, where he used waka as a metaphor for, an analogy, a metaphor for sexual health, and it was quite a powerful presentation. Anyone who was fortunate to be there would recall that it was a very powerful presentation, so we're very honoured to have him as part of, to support our project. So in total there are 7 videos. Video 1 is the introduction, and then because we, in our research about what works with videos, they have to be short and concise and not too drawn out. So because the pōhiri element is so fundamental and so important, and by that I mean that if you get that aspect of the engagement process wrong, then everything that you do after falls over. So it's an important part of the process, and we decided it was too important to try and truncate into one video, so that's covered over 2 videos. So pōhiri element part 1 and pōhiri element part 2 are videos 2 and 3. Video 4 focuses on the hariru element, the partnership building stage of engagement. Video 5 on the hākiri element, the implementation stage. Video 6 on the poroporo aki element. You can read this yourselves. So I'll just say here that these names, pōhiri, hariru, hākari, poroporo aki, are aspects of the process of a pōhiri ritual, important aspects of that ritual, and so we've borrowed those to portray the different stages of engagement. Each video follows a similar format. Key concepts associated with each stage of engagement are introduced. Information is provided that will help promoters think about and better understand important cultural considerations when building relationships and partnering with Māori communities. As well, promoters are encouraged to develop an ethically sound practice, incorporating critical self-reflection, and to build their capacity and improve their health literacy. And I suppose that's where that whāriki design really struck me as being appropriate. Each video ends with a pop-up summary that highlights key points covered, and links are provided to self-reflection exercises and resources that can help develop a deeper understanding of the concepts and approaches discussed. As well as that, for each stage of the pōhiri model, a link is provided to practice scenarios. Promoters can workshop these along with colleagues to develop their thinking around how the information provided can be integrated into their sexual health promotion practice. And so when we did the pilot earlier with family planning, in the evaluation and feedback that we got from them, this kind of practical application of the theory was really, really helpful. And the idea that they would workshop collectively to help each other understand and practically integrate those ideas into their work, I think was really worthwhile. So we've included these in the videos. As I said earlier, today we are launching stage 1 of the video series, videos 1 to 4. And then following an evaluation of that stage, we will then proceed on to production of videos 5, 6, and 7, which will be available on our website by the end of November, which is soon. So I encourage you all to view these videos on our website and to give us some feedback, please, so that we understand if you find them helpful, if you think they could be better, could be improved in some way. That's all valuable to us, and we will respond. And so in the meantime, we're going to just watch a very short edited excerpt from video 4, the hariru or partnership building stage of engagement. Mauri ora kia tātou. You said if I pushed the button, it would. So it's not my fault this time. Do you want me to push the button, or are you going to do it manually? Oh, here we go. Okay. Have we got some sound?
Welcome to the Hariru element, partnership building to engage effectively with Māori communities. Once a partnership is established, all aspects of the project plan, aims and objectives, methods, resources, budget, outcomes and evaluation should be discussed and agreed collaboratively, using the expertise of both parties. Promoters need to be able to identify and account for the structural determinants of sexual and reproductive health and incorporate strategies into the project plan that foster and promote Māori community control and advance Māori values and approaches to sexual and reproductive health. When developing the budget, appropriate levels of koha should be allocated for key members of the community who collaborate on the planning and implementation of the project.
When collaborating with the Māori community, you remain manuhiri, a visitor with obligations and responsibilities for the duration of the partnership. Primarily, these are about showing respect, treading gently, and being accountable to the community. On that note, promoters who are new to working in collaboration with Māori communities are advised to seek advice and support from their professional bodies, a Māori advisor, or associated Māori health unit. If the cultural support you need cannot be provided, it may be better to refer the project to an organisation more skilled in that area, rather than risk compromising your relationship with the community. Throughout the partnership building process, maintain a practice of critical self-reflection on your personal values, beliefs and understandings, your obligations to the Māori community, and your commitment to building your cultural competency and health literacy.